Hello and welcome to YHTV's Magical Medical Tour. This is episode 38. Thank you for joining us today and here on our newest platform to bring in 2013. So we hope you enjoy this new transition that we're making. I'm Christina Suzama, and with me is our wonderful medical guide, Dr. Glenn Woolman. Hello, Dr. Woolman.
Greetings, Christina. How are you?
Very well, thank you. Now that the rain has just cleaned up our whole city and coastline.
Yeah, all our plants are smiling and happy.
And so are we.
Yeah. I'd like to take this moment to greet everyone that's watching, all of our viewers. And I guess I could greet the viewers that will be watching this at a later point also. So welcome to Magical Medical Tour. I'm Dr. Glenn Woolman. I will be your co-host with Christina as we travel each week through the healthcare galaxy, searching for ways towards optimal health.
Mm-hmm.
That's fun, isn't it?
Oh, yes. You think we'll ever find it?
Yes.
As we come closer and closer and closer.
Yes, I do. I think we will.
Sometimes it feels like the abyss.
That's funny. A lot of times people have said to me after the show, and at other times, they say, you're a medical guide. I like that. What is it?
Mm.
And so I was thinking I would take a little opportunity today to talk about being a medical guide and then a few of the things that I do as a medical guide, if that's okay with you.
Oh, absolutely. I think that's great because we do need to remind everybody, and me included, you do so many things.
That's true. It's so many things. And that's the cool part about it. And it's growing. When I decided to do this, it was at a time, there aren't no actual medical guides that I know of yet. There are people doing medical guiding, and all people that are healers of some kind do some medical guiding. But my whole specific process is about medical guiding. And it starts from the point of having life. Creating life. Sometimes I help people to get through a pregnancy or to become pregnant. And then once life is created, then I also have the ability to work with people throughout their lives, either while they're healthy, remaining healthy, or obtaining good health or optimal health, maintaining it, or regaining it. And then I also work with people if they get sick, try to get through a sickness, or if they are not going to get through it, dealing with it. And also, I work with people towards optimal health when they are pretty healthy. And clearly, I also work with people when they're dying and transitioning out of this body. But the part that I wanted to focus a little more on today was the part about helping people gain optimal health. And we talk about that a lot. And if people, want to call in today, it's kind of a free-for-all day a little bit. If people have some thoughts or questions on anything and they call in, we can try and work that into a little bit of what we're dealing with today to maybe give an example of what I do as a medical guide. But in terms of optimal health, I've talked about this before, that I look at a number of categories for people. I look at nutrition, exercise, stress management, sleep management, spirituality, and patterns of behavior. A few weeks ago on one of our shows, we talked about spirituality, and I'd like to take an opportunity every once in a while to talk about each of the different aspects of what I do in terms of those areas. Certainly we'll have guests on in each of those areas too. We've had specialists in sleep and stress management, and we'll have nutrition, and we will have exercise and a number of other things. But I thought for a few moments I would talk about patterns of behavior. And one of the reasons that I think this is a specific area that does need to be addressed for everybody, and I'd like to present my case now as to why I believe it, and see if at the end of today's show we've figured out that you agree with me, or some other people agree with me. Patterns of behavior. So let's talk about that for a few minutes. As a species, and almost every species has patterns within their physiology. A woman goes through patterns of a menstrual cycle in order to become pregnant and to procreate and to sustain our species. So that's part of the cycle. And if you're not in that cycle, if you're not in that pattern, then the pregnancy may not take effect. Once the pregnancy takes effect, the body starts growing, the embryo starts growing, and different things start happening so that this little body that comes out when it takes its first breath is already prepared. And that means all sorts of systems have to happen within the body. So the brain stem and the nervous system are starting to develop, and all of the systems, the cardiovascular, the gastrointestinal system, the musculoskeletal system, all of these things are developing. Within about 4 weeks of the embryo starting to develop, you can actually see the beginnings of a primitive heartbeat, 4 to 6 weeks. And a heartbeat is an example of a pattern. When we're a certain age, our heart beats a certain amount of times per minute. For most normal adults, the pattern is somewhere between 60 and 100 beats. And it changes. If it goes into an abnormal rhythm, then we have to deal with that medically. And that's one of the areas in the emergency department I always had to deal with, where the heart stopped its normal pattern. There are also many other physiological patterns. Breathing is a pattern. We breathe in about 16 to 20 times a minute when things are normal, maybe a little less when we're sleeping or relaxed or meditating, and a lot more when we're running in a marathon. There are waking and sleeping patterns. There's pH and acidity patterns. There's temperature patterns. If you take the temperature of a child in the morning, it's different than in the afternoon or at night. Which is important when you're trying to determine if a child is sick or you're sick or something like that. So we have a lot of physiological patterns. And it appears that most of these patterns occur on a subconscious level. They occur deep in the primitive brain, almost in the brain stem, not in the higher portions of the brain where we discuss philosophy, but in the deeper portions. Because if you could imagine, let's say I said, okay, Christina, for the next hour, you have to control your heartbeat and be aware of every beat and think about it. And at the same time, you also have to breathe. And it's also at the same time, you have to make yourself a sandwich and eat it and digest it.
And breathing all in that certain rhythm, right?
And breathing in that rhythm. It would be impossible for us. So the brain, in its own wisdom, and our species and most species, have this in the autonomic nervous system, or kind of the subconscious automatic nervous system. Now, we can get into another discussion about breathing, because it's one of the few things we can actually tap into in our primitive brain, which is one of the reasons probably that in meditation techniques, breathing is such an important part that we can connect. But that's another show. So these are physiological patterns, and what it shows us is that the brain feels that it can do a better job than we can. Just like I said to you a minute ago, okay, you're in charge of your own heart rate. So the brain takes over and does these things. Well, when we're born, and probably even earlier for certain things, we start developing other types of patterns, not the physiological patterns, but patterns of behavior. And the reasons we develop patterns of behavior is basically for survival, to know ourselves, to take care of ourselves, to deal with ourselves, to know and deal with other people, and to survive. Sometimes someone in a very challenging household develops patterns of behavior to survive that are not necessarily great patterns. Many of the patterns we learn are great patterns, and they help us survive. You know, when your parents teach you to look both ways when you come to a street corner, That's a very good pattern of behavior that we learn and continue throughout our lives, and it serves us well, especially if we go to a country where they're driving on the wrong side of the road. Or I guess I should say opposite side of the road.
That was good.
Yeah. Or on no side of the road, or there may not even be a road.
There may not be.
Or it may be an elephant that's you're riding on instead of driving.
Camels, yes.
Right. All of these things are possible. But we learn patterns of behavior. And again, we learn patterns very early on. We watch our parents, we watch other adults, and we emulate them. And we keep those patterns, many of those patterns, and we keep them throughout our life. Some of them good, some of them not so good. And this is an area that I look at, which is very important, because again, we seem to find that patterns of behavior also become subconscious, where the mind feels or the brain feels it can do a better job than we can. So it tries to take away all of these tasks from us, and we just do things on a subconscious level. Getting out of bed, we get out of bed the same way every day, most of the time. You wash your face, you brush your teeth, you take a shower, you take a bath, you put on your clothing, put on makeup, start a car. All of these things become patterns of behavior that we don't even think about during the day most of the time, which is fine. It serves our purpose so that we can be getting dressed and not having to think, do I always put my left leg in first, or do I tie my right shoe first? Or if we had to do that, we wouldn't be able to worry about all the anxious things that we have to do during the day. So this gives us the opportunity to put our brain into thinking about other things, because we mindlessly are able to do certain patterns of behavior. And we also, when we talk about mindfulness, this is another process that takes those things that we do mindlessly and bring them into process. So when I work with people to try and achieve optimal health, the reason that I feel that patterns of behavior is a certain important aspect is, one, that we are about patterns of behavior, but two, that in order to work on all of the other aspects like sleep, changing sleep, or nutrition or exercise, it's the patterns of behavior that we have within each of those processes that determine how we deal with them. So if I recognize in someone that they have a pattern of behavior that's causing their illnesses, or that's not attributing to their optimal health, then that's a process that we have to go through. So do you, for example, believe in patterns of behavior?
Oh, yes. Oh, yes. Very much so. I mean, well, especially the ones you said that we're born with, those patterns of the behavioral part, it's almost, to me, it's almost like a way of survival.
Of course it is.
Right?
That's right. It's about survival for yourself and survival with other people, and then survival in general. That's exactly what it is. We learn these patterns to survive. But unfortunately, as we go through life, certain things happen that influence our patterns, or we get stuck in patterns that we don't believe we can change. And changing those patterns is an important part of the process. So when I work with people, one of the areas and aspects that I work with is to figure out that, first, are you aware that you have patterns of behavior? And we go through a little bit of testing on that. And once they usually and finally agree that there are patterns of behavior, then we start looking at aspects of their life that are good patterns, and we look at aspects that are patterns that are neutral, no big deal, and we look at patterns that might not be helping the process. So after we determine that people have patterns, the first step is to actually recognize that a person has patterns. And once they agree to that, then the second step becomes about, do you want to change your pattern? You have to make a choice here.
Now that seems really interesting, how you have said this, Glenn. Are you, in your experience, are you saying that there are individuals that don't realize that they live by patterns?
They probably are just not thinking about it. They do realize it on certain levels, but they can also compartmentalize. They may know that they brush their teeth the same way, but the woman that has been married 3 times, and each time it's been to an alcoholic, abusive man that they've gotten divorced to, they don't recognize that necessarily as a pattern.
That's interesting.
So our consciousness and our subconsciousness and deeper consciousness sometimes hide things from us because they like the patterns, or it's easier for the pattern than to change the pattern. Once we have a pattern, the brain gets into that pattern, and it doesn't necessarily matter that it's good for you or bad for you. That's the pattern, and it likes to stay like that. So when the brain starts getting information saying we want to change a pattern, it does a lot of things to potentially prevent that.
Interesting.
Part work that has to be done.
Right. It's like to shift. Making that shift is a difficult one, or seems to be.
It is
a difficult one.
Even the simplest of things can be difficult. But if it's affecting one's health, and remember, that's why we're talking about this for optimal. This is one of the aspects that I talk about that. So it doesn't matter if you put your left shoe on first or your right shoe on first necessarily.
But it does if you're putting it on your head.
Decide as a pattern of behavior not to brush your teeth. You put the toothpaste on from the top to the bottom, or the bottom to the top, or you squeeze the toothpaste from the bottom, or squeeze it everywhere and don't worry about it. And it doesn't matter if you start in your left back, upper, posterior molar, or your anterior medial incisor. Those things may not matter, but it may matter if you don't brush your teeth at all. That may have to do with optimal health, and we'll learn that when I interview one of our professional dentists or someone in the area of dentistry.
That's going to be fun.
Learn a lot the teeth. But everything we do has to do with patterns, including social patterns, of how we socialize and how we date and who we're looking for.
And the pods that that's something I realized and have really noticed with some of my clients. It's the type of people that they have socialized with and created the pods with. And that is also very difficult to shift as that pattern of behavior, right?
It is, because some of the times you will create the pod that serves some of the patterns of behavior that you have. You're encouraged to have those patterns. And if it's not a great pattern, if a pattern, for example, is to be addicted to heroin,
right,
you're probably going to be around heroin addicts rather than Nobel Prize winners most of the time, because Nobel Prize winners may try to convince you not to continue that pattern. So sometimes we choose people to be around that give us good feedback or allegedly good feedback on our patterns and encourage those kind of patterns. So that, yes, you're right. When sometimes you can be around people that are not encouraging your optimal health, so you have to make big shifts. Yeah, that's very true. So after the first area of awareness, then it becomes the recognition. Then you,
I thought, a wreck.
Then you have to make a decision or a choice as to whether or not you want to change that pattern of behavior because you recognize it. And this is one of the more difficult steps. Becoming aware that there's a pattern is not too hard to work with a person, but making a choice not to, especially if it's something that's helped you survive your whole life, you feel pretty comfortable with it, and it doesn't appear to you that it's something deleterious to you. And it may not be that bad. We all have a few patterns that are kind of not always perfect for optimal health, but they make us happy. And so we continue those. And it's just the judgments about which one we take and which one we have to let go.
Mm-hmm.
So after we make that judgment, first we have the awareness, then we choose to change it. Then comes the part of having to figure out how to change a pattern of behavior. And the way that you change it is that you have to figure out a new pattern. So you start thinking of ways that can satisfy certain needs and get rid of some of the reasons that you don't want to change it and why your brain is fighting it.
Mm-hmm.
And that becomes a lot of the work that I do with people, because it again, changing a pattern of behavior about nutrition, or changing a pattern of behavior about exercise, or changing a pattern of behavior about sleep. All of these things require changing patterns of behavior to get towards optimal health.
Mm-hmm. Mm-hmm.
That pattern isn't easy.
Mm-hmm.
So we have to make choices of a new pattern that will satisfy us and become our pattern, the new pattern. So there I go.
And it takes time too. It's almost like it's almost like when that awareness is like sowing the seed, and then you have to sort of nurture it and fertilize it until it grows, right? And it becomes sort of like within your new habits and your new behaviors.
Becomes your pattern.
Mm-hmm.
Right. And many people don't want to let go of these. And this is where it's interesting, where I talk to people, and nowadays it's depending on who I'm speaking with. If I'm speaking with a younger person, they understand this more. But I can say to them that the brain and the central nervous system is your hardware. That's your hard drive.
Mm.
Pattern of behavior that you're exhibiting is a software pattern that might have come into play at a very early age when you needed to survive. For example, if two parents are breaking up and there's lots of conflict in the house, and the child, who has no understanding of what the conflict really is about, just gets an understanding that there's discomfort, they may develop patterns of behavior that allow them to survive with both parents. And because those patterns of behavior get reinforced because they continue to survive, they keep them. So when they become an adult and those patterns now are causing all sorts of internal conflict because they're manifesting in other ways, when it's time for them to find the right mate, these patterns come into play, and they don't see them necessarily as patterns.
Mm-hmm. Mm-hmm.
Yeah. And sometimes they even see them but can't deal with them, or believe that they're so deep, it's just me. There's nothing I can do about it. This is have to be. And this is where we talk about the possibility that it's software.
Software. I like that.
Upgrade your version.
Now, next you'll be going, the 3.0.
That's right. Christina 5.0.
There you go.
Not only can you sometimes change them or upgrade them, but you can also delete older patterns.
Mm-hmm.
And now, certainly, let's not make this so totally simplistic. There are many people that have very critical patterns for reasons of survival or whatever, that are so deep that you can't just change it by saying, oh, yes, I think I'll brush my teeth differently now. Sometimes people need help from counselors and healers of different types, and people may even need medications or different types of treatments for things, depending on how deep and how harmful the pattern is. But that's where the choices have to be made. You have to choose whether your life is worth it or not worth it, or whether you want to take the responsibility or one does not want to take the responsibility. And then we go from there.
And also, when you go back to those social pods that we have created, or the people who are familiar with us, I also find it very difficult for people to take those shifts because you have the individuals around saying, that's who you are. That is your habit. Or, oh, can't teach an old dog new tricks. All those comments.
Right. And those are patterns of behavior.
Yes.
Patterns that the other person learns.
Mm-hmm.
So we're all about patterns. It's fascinating, and it's really a major key in the whole process here of healing. Sometimes, so where are we? We have the awareness, we have the choices, or the decision to change, and then we go through choices or picking a new pattern, and that becomes very interesting for me as a medical guide because it's not me and it's not my pattern that has to change. So when I work with people as a medical guide, we may go through many choices of different patterns. I will suggest some and have the client suggest some, and we talk about all of them and we think about lots of different patterns. We leave it very open because it's going to require a change and it's going to be something that the person is then going to do, hopefully from then on. And so once we figure out, okay, this is a good pattern, we like this one, and we're going to change our old pattern, then the next step is implementing it. And there's a whole set of things that have to be done for each person. And again, a lot of this is really based on the person themselves. And this is, again, where as a medical guide, things are different for me than they were in the emergency department where I used to work. When I worked in the emergency department, whoever came in, I took care of. Mm-hmm. And I with them, and then they went on their way or they did not make it, depending on what they came in with is how they left. And they didn't have to take too much responsibility in that moment. If I had somebody with a dislocated shoulder, I could put that shoulder back in, whether they, felt comfortable with it, didn't feel comfortable with it, were scared of it, were afraid that I was going to hurt them. I could do enough things to put that shoulder back in without too much of their cooperation, although cooperation always makes life easier. But as a medical guide, if I find that someone has a pattern that is not good, for example, eating, say, too much refined sugar, at some point, once we determine that that's a pattern and we're trying to deal with their diabetes and their obesity and their inflammatory arthritis and a number of other things, once we recognize it, we have to change it. It becomes something that they have to do. I can tell it to them, and I could bring it to their attention, and we can come up with the solution. But at the end of the day, I'm not at their house, and I'm not getting rid of the refined sugar, and I'm not stopping them from eating it. So at some point, they have to make that decision. And when one makes that decision, difficult at the beginning, but usually because it's something that you're improving, you start seeing improvements in your own health. And that's really the key to reaching optimal health, is going in increments and seeing that here's a benefit. So, for example, I always talk about in eating, if we're trying to get someone to eat well, you can't take someone that never ate well and then start them eating 100% well. And I look for an 80% rule. And I say, start with 80%, start eating more healthy foods in healthier manners, and don't worry about the other 20%. Stay with whatever you're doing. And when they do that, they can then start seeing results. Well, that stomach ache that I always used to get after eating isn't as much anymore. I go, how interesting. I wonder why. So then I say, well, maybe it seems like it's pretty easy and you're feeling better. Why don't we think about 85% better and then 15? And then eventually they catch on and they see, and maybe they'll go to 90 or 95. You don't always have to get to 100%, and not many people can. But again, getting closer and closer towards optimal health is a great way to do that. So we figure out these patterns and recognize them and come up with a choice and then implement it and figure out the right ways to implement it. And then once we implement it, the hardest thing that happens then is to maintain it. And you brought that up a little while ago. And one of the things that we see is people gradually float back into their old pattern without even realizing it. So the final part of what I have to do in this whole process is to make sure that we have a way of following up and checking in with ourselves and saying, that pattern that we changed, it seems like we're out of it again and we're back into our old pattern. So it's very important not to just be aware, make decisions, make choices, choose a new pattern and implement it. You also have to make sure that you're continuing that pattern because you can go into it. And I have a test for people that I usually do just to show how important patterns are and how the whole process is and how sometimes it's difficult, even on a simple basis. I usually take something with a person and tell them to find a pattern. Sometimes I use brushing your teeth. Sometimes I use showering. But it's something that you do every day. So, for example, if you shampoo your hair in a shower and you always shampoo it at the very beginning or you shampoo it at the end of your shower, that's a pattern of behavior.
Mm-hmm.
And it's not necessarily a significant pattern whether you do it at the beginning or you do it at the end. It's not that critical. It's just that you do it. So what I would say to people is, okay, take that pattern and change it. From now on, if you shampoo your hair always at the end of your shower, you wash yourself and soap yourself and clean yourself first, and then you do your shampooing, try and do it at the beginning. And just make that a change in behavior. And even almost inevitably, even the very first time I tell them to do that after my session with them, I will speak with them the next day and they'll go home and say, oh, I thought about it all day long. And then once I got into the shower, I started thinking about other things and suddenly realized I did my old pattern. I totally forgot about it. And I said, yes, I understand that. And that's a pattern of behavior.
Well, I can say that if one has a child, you change your patterns very quickly and continuously, month after month.
About your own patterns or patterns of how you deal with your child or your
child? Your own patterns. You almost have to change your own patterns to adapt.
Give me an example.
The example would be something as simple as how you run your day. Like, if you didn't have a child, you would wake up, you would do your, whether you go wash your face, brush your teeth, or have your breakfast or cup of coffee. The minute you have a child, that all changes. You might do that, but it might not be in that order anymore. Mm. And when you think of a baby, their patterns change and fluctuate week by week, for that first whole year. There is no, one moment you're getting 5 hours of sleep. The next moment you're getting 6. The next moment, they're waking up at a time of day or night that you never would have thought of, or decided to take a nap at a certain time. And what you thought that, you would consistently do, you're not doing anymore.
It's interesting that you bring that up. As you were saying that, it's correct. I wonder, and this is kind of a rhetorical question, but parents that are bringing their children up are exhibiting patterns of behavior. And it would be interesting to see how much of an awareness that the parent has that this is a pattern that I'm teaching my child. The way that the family meets at the breakfast table or at the dinner table, and the way the two parents have a discussion. When the child is watching that discussion, the way that the parents talk, if one listens while the other speaks, or they both interrupt, or they argue, then you will probably see that type of a pattern developing in the child. So it's very interesting to work. Sometimes if I'm working with the child of a parent, sometimes I have to work with the parents also, because the patterns are coming from them, and we have to figure out these things. So it's very important for parents, if you're choosing to become parents, to realize that all the things that you do that you think that your child isn't watching and learning while they're at their most sponge-like time in life, and everything is coming into them, although as they assimilate it, they're not necessarily understanding. They're just assimilating certain things, and they may not be coming up with the correct facts, but they are coming up with patterns. And so it's very important to become aware that you're teaching your child patterns. And if you see your child doing something wrong, your first thing is you want to go, what's wrong with my child? Why are they doing this wrong? Rather than saying, I wonder if there's something in me that has helped them to promote this.
I love that, Glenn, because I always tell parents, they are our mirrors. They truly are our mirrors and the mirrors of the world, because, as you say, they assimilate things so quickly. And I remember the times where there's a fear of, oh my goodness, where did that come from? Okay, do I do it? Does his father do it? Who around us does that? And if I go through everyone, no, let's see where else it could be coming from. And, and sometimes if it's not around that often, it's just for the spur of the moment, like maybe a couple of days and then it goes away. But it's true. You're absolutely right. They continue our patterns of behavior, and whoever is around them is great, major influences on on what they choose to do and when to do it.
And this is why we have psychologists and psychiatrists and behavioral analysts and sociologists, is because throughout our history as a species, as we've come into communities, we've developed some of these patterns that cause issues. And those issues are things sometimes that can be recognized and changed. Not all of them, and not all of them without a lot of personal work and a lot of work with help. Mm. And I think also it's very important to realize that, for example, let's say you're in a family of 3 children and 2 adults, and one of the children has a diabetic problem. So they need to eat carefully and more appropriately. Not that we all shouldn't, but it's more specific and more obvious that things can go wrong for someone eating inappropriately. So when you spoke before about the pods, we choose certain pods, but sometimes a family is not really a chosen pod. That's the group that you hang out with, maybe your chosen pod, but the family is a different type of pod. And it becomes important to have encouragement from the family. If the other kids are sitting around eating candy bars all day long in front of the diabetic child, it's going to be a lot more difficult for that child to develop a healthy pattern of behavior. And so it's very important that as a family, everyone become aware. The kids may not understand it as a pattern of behavior, but they don't have to. The parents need to understand it as a pattern of behavior. And this all comes into the process of healing, too. It's very connected to the whole process of healing. And the reason I say that is because we can look at healing, and we've spoken about this before, on many levels. There's the physical sense. And for me, especially when I was in the emergency department, and now too, but not as quickly, I have to determine whether somebody is coming in with a physical problem, a mental problem, or a spiritual problem. Is it about their body, their mind, or their spirit? And most of the time in the emergency department, it was about the body. The body has a cut on it. The body has a bullet in it. The body has something broken. The body has pain. Some of the cells are hurting. Some of them are inflamed. Some of them are dying. So it's very body oriented. And so part of the work has to do with, and now again, as a medical guide, in looking at people's bodies where they keep having things go wrong and they're not healing from the medicines that they're taking. Well, first you have to figure out on a scientific basis in Western medicine what's going on. Why is there something wrong? And usually, most of the time, we can figure that out on the cellular level, and that's how we have to treat it. But then we see that people don't always. They may heal from whatever recognized diagnosis came out in the treatment, but then they may have a recurrence of something. And so after we've figured out the cellular level, sometimes it's important to go to the mind level and figure out what's going on there. Why are these things recurring? And that's part of where patterns of behavior come in again, because we can't just look at what did you do this time physiologically to hurt this or to cause this illness, but now what are you doing from a pattern and a mental point of view to cause this process to reoccur, even though it shouldn't have reoccurred once we treated it. And then it has to go to a spiritual level also. And again, there are patterns of behavior within a spiritual level. So as part of the process of a medical guide, when I'm working with people, as I said, the ones that are already healthy and want to achieve optimal health, we can work on these in an easy manner. But the people that are sick or that are chronically ill, that have a problem that the Western doctors they can sort of appease, but they may not be able to totally control. You know, medications can do a lot of great things, but then you have to keep taking medications. And this allows me as a medical guide to use my combinatorial medicine process, where I look at Western medicine as the backbone and central nervous system of healing. But sometimes Western medicine doesn't always cover everything. It's very good in trauma. It's very good in acute diseases. It's very good in diagnostics. It's very good in critical care. Not always so great in chronic care. Not so great in death and dying, although we're getting better in many of these things. But some of the other healing systems on the planet seem to offer things from another point of view, both looking at a person differently and looking at potential for healing. So when I decide, when I'm working with someone, where I start using my combinatorial medicine, it's because I believe that people heal for a few different reasons. People heal, one, because the treatment is a healing treatment. If someone has a sore throat and it's a strep throat and it's a bacterial process and we have the right antibiotic, they will heal from that. That's a good thing. Sometimes people will heal because they have a belief in a system. So may believe that pain medicine is so bad for you that it causes so many side effects that they have so many bad side effects they can't take it. And yet acupuncture, for example, may not have any of those side effects, and it may help them with their pain. We don't always know whether there's a good scientific physiological answer for that, or we just haven't found the tools yet to actually measure it. But if somebody does get better, and if somebody went to a dentist and they're in such pain and they go to an acupuncturist and they're out of pain just because it's a belief system, then that works. And for me, in my process, I look at all of the different systems that are out there in the world, and I find out if anyone is healed from any of them. And if someone is healed from one, then I look into it. Because not necessarily is everyone going to be healed from that, but that's the same with Western medicine. Not everyone will be healed from a cancer surgery. Mm-hmm. But if I find out that there is something to it, then I will start researching it, and I will even participate in it. I will go to acupuncturists. I will go to Ayurvedic doctors. I will go to shamans. If I hear that Reiki, for example, is good for something, I will read about Reiki. I will study Reiki. I will meet with Reiki masters, and I will experience Reiki. And once I get this in my armamentarium, then in my process as a medical guide in trying to figure out how I can combine medicines or use combinatorial medicine for people, I have to find out what their patterns of behavior are. And so this is another reason that is a very important aspect for me. Why I look at patterns of behavior.
It just sounds to me like it's not just the patterns of behavior, but it just leads into all the patterns, like the rhythms and everything of someone's physical being and spiritual being. You've just combined it all, haven't you?
Exactly. It's all patterns. It all seems to be patterns. You look at patterns in nature and start looking at these esoteric geometric shapes that have things in them. Why is there a certain shape in a shell and maybe in a rainbow and in a plant? What similarities do they have? There's patterns in everything.
So it's quite amazing right now, Glenn, with right now our weather patterns are shifting. Our environmental patterns are shifting so drastically. I was just in a conversation with I don't know what you call them, a gardener, a nursery for specific plants. And they were telling me that, amongst their many acres, because the weather shifted so drastically, it's almost like spring weather here in California. The birds are, they're laying their eggs right now because it's so warm.
Everything is funny. I was thinking this morning about, I think it's Newtonian physics.
Newtonian physics. What can you explain, please?
Sir Isaac Newton. I think it was Newton, and I'd hate to quote something from the wrong person, but we can certainly Google it now. Where you've heard this, a body at rest tends to stay at rest. A body in motion tends to stay in motion. This is inertia. Okay. You follow that?
Yes.
Okay. So now, if you have a pattern of behavior, let me add one more part to that. A body at motion will stay in motion unless acted upon by another force. So in other words, if a car is driving 60 miles an hour going east, it will continue driving 60 miles an hour. But if a truck going 100 miles an hour is traveling in a different direction and hits it, that car will travel differently.
Or not at all.
Or same thing with the body at rest. If the body is at rest, it will tend to remain at rest unless acted upon by an outside force. So if somebody is sitting in their chair, hanging out, and is just being a couch potato, or is it a sofa spud? I don't remember.
A sofa spud? I like that.
Other version of couch potato. But that person will stay on the couch until the other person comes up and says, hey, let's go out to the beach, or let's go for a walk, or let's do this or that. So they're being acted on by an outside force. This is the same with patterns of behavior. A pattern of behavior will stay in its pattern unless acted upon by an outside force and change it. And so that's what we have to recognize. And sometimes we want to put that pattern of behavior at rest so that it doesn't act anymore, unless, again, it's acted on by an outside force, or we want to eliminate it. But that's how I'm combining combinatorial medicine, Newtonian physics, and spirituality, mind, and body.
So I wonder what's going to happen with all this environmental shift to our patterns of behavior.
Well, this is the key. Right now, you can consider the Earth had its patterns of behavior, right? Been acted upon potentially by an outside force, us. And changes are going to happen. So either the Earth is going to eliminate the outside force, or the outside force will potentially eliminate the Earth, or there'll be adjustments on both parts for survival purposes. It's an interesting metaphor and an analogy. Yes, I look at my plants and I look at my flowers, and things are budding at the wrong time of the year, and it must be very difficult being a enologist or a wine grower right now. To concentrate and to have all of the patterns of knowing when the season of this agricultural product is, and then having changes. It's very interesting and very difficult. We're going to see more patterns of behavior changing, and then we will either adapt, or now we could talk about Darwin, we will not survive.
Oh, then so much for patterns of behavior, right? That's the 100-ton truck coming the other direction.
That's right. We have to figure all this out, and if we don't have any more on that, I wanted to talk about a few other things that I'm looking forward to in our future shows, since we have an interesting one. So if there's anything else you wanted to think about with patterns of behavior.
It's just, thank you for sharing with us what a huge part it takes in our health and in our balance, because to hear you articulate it so simply, which it's not easy. You've gone through so many different variables of it, and hopefully our audience will be able to understand at your beautiful articulation about patterns of behavior and how it does affect us, that people become a little more conscious and aware of, the things that they do and the things that they choose to do. Because I always say it's a choice, and the decisions that they choose to make towards their optimal health. So, thank you very much for that, Glenn.
Yeah, I would challenge everyone, all of our viewers, listeners, etc., to just do an experiment. Do the experiment we were talking about today. Find a pattern of behavior that you do, a simple one that's not a big deal, that isn't life-threatening in any way, and see if you're capable of changing it. Mm-hmm. If you use a fork in your left hand all the time, change it to your right. That may be a little more tough than changing which way you brush your teeth, up or down or left and right. But go through the process. Become aware of a pattern. Make a choice to change the pattern. Choose an alternate pattern. Implement that alternate pattern. And then over time, see how long you are either capable of keeping that new pattern or how quickly you went back to the old pattern. And even see if you're capable of doing the first part, becoming aware and remembering to do that tonight. That'll be a fun aspect. Yeah, I would challenge everyone to do that, and maybe somebody can call in or write in and say, "Hey, I did this, and now I don't even look both ways when I go to a street corner. I just walk right across the street." Actually, we don't want that to happen.
We don't want that, no.
See, I want it to be funny for a moment. Maybe I need to change that. So we'll see if that happens in future shows. Change that pattern or not.
No, we want to keep being funny.
Yes, fun is fun.
Fun is fun. We can educate through fun.
And I'm glad you said that, education, because that's a perfect segue into what I wanted to talk about in our last few moments of the show. One of the things, we have a number of purposes for this show. We want to show the magic of medicine. We want to really show that to people. And the first way we try to show that is the heart and soul of the healers that we have. And we've been doing that. We also want to give current information to people, which we're trying to do to help them in their own choices for optimal health. A third thing that we do kind of in the pillars. I look at the 4 pillars of Magical Medical Tour. The third pillar for me is to show people what kind of careers are out there in the medical profession and the healing profession, and how people can make different choices and be very creative within those fields. And the fourth pillar for me is to kind of have Magical Medical Tour as a 21st century guidebook, so that people can remember that, oh, there was an episode on plastic surgery, and I'm thinking of plastic surgery. Maybe I should go check on that and look at that one. Or there's one on infectious diseases, or there's one on sleep. So I want to have, at the end of when we finish, right now this is our 38th episode, I'd love to have a number of episodes where it just compiles a lot of information as a guidebook for people in terms of achieving optimal health. And one of the things that I'm thinking about adding to the show, many different aspects that we've already added, is every once in a while doing some teaching of maybe anatomy to people, so that we can start learning a little more about our bodies and not fear of our bodies and fear of the unknown, and just pick a part of a body. Today we're going to look at an elbow joint or a knee joint, or we're going to look at the cardiovascular system or the skin, or here's what an eye looks like and here's how an eye works. So I'm thinking about doing that on some future shows. And now that we have we've upgraded to some of the technology, I'll be able to show some charts and visuals and add some things to it that will help people in the learning process to make it easier for them to learn. Does that sound good to you?
That sounds really exciting. I think that'd be very, very helpful, because it's funny, you learn a little bit. If you have an imbalance in an area of your body, that's when you learn about the anatomy, right?
For that moment.
And then you forget all about it until the next time. So I think this would be really great.
Yeah, it's going to be. I think so too. Again, we want to make this fun, but we also want to, at the end of the day, make this educational for people. Mm-hmm. I said, if this could be educational, and it could be something where people turn to it and know that, oh yes, my elbow's hurting. Maybe I can go. They did a show on the elbow. Maybe I could look at that and figure out a little bit about what's hurting, and maybe I can take care of it at this level before having to see a physician.
But also, what in some of our earlier episodes, what we had talked about, Glenn, too, was to be prepared when you do go see the physician.
Absolutely.
It's like then you there's an understanding of what he's actually saying, and the possibility of as the patient able to articulate to the doctor what it is that is what the imbalance might be.
Yeah, it sets up another whole relationship. If you walk into the doctor and say, I think I have a lateral epicondylitis. Doctor suddenly takes on a different light with you.
They might just say, we're going to refer you somewhere else.
That could be. Anyway, I think I've said enough today.
You've said enough today? You're done for the day, our medical guide?
Ready to blast off into another portion of the galaxy to search for more optimal health.
Fantastic. Thank you so much, Dr. Glenn Woolman, our medical guide, for enlightening us on exactly what it is you do, which is like a whole universe of wealth of information. I would like to thank each and every one of you for joining us and your continuous support with this whole new platform of education and information. We are grateful for your continuous support and look forward to hearing from how we can support you better. So, do let us know if there are some topics that you would like us to cover. We're also excited to announce that we now have access through iTunes. And so when you go through iTunes, just look for YHTV or Magical Medical Tour. And that will take you right to the whole series of podcasts of this show. Again, we invite you every Tuesday at 10:30 a.m. Pacific Standard Time, 1:30 Eastern Time for this show, Magical Medical Tour. Wednesdays for Trinity of Life at 11 a.m. Pacific Standard Time, 2 p.m. Eastern Time. Followed every other week with our new show, Flowing into Awareness with Anatara. You can also be in contact with Dr. Glenn Woolman at myyogahub.com/G Woolman and on Twitter at Glenn Woolman, and of course through his own site, glennwoolman.com, where you can learn about his metaphor square breath to keep you grounded through this very, very fast-moving times that we're in. Until then, we will see you at our next live show, and we look forward to it. Namaste.